Leslie Hobson, VP of Clinical Operations at Self-Fund Health. I've been a nurse for 15 years. I've been with Self-Fund Health for just under 2. Prior to Self-Fund Health, I worked in the health tech space, so helped implement software with health systems, mainly working with providers and nurses and being a liaison between them and our product and software engineering teams. Prior to health tech, I worked in the hospital doing med-surg nursing, so inpatient nursing, and I also have worked in multi-specialty clinic as a lead RN, specifically with gastroenterology, neurology, gen surg, and ortho trauma. When I am not a Self-Fund Health nurse navigator, I am busy with 3 kiddos, 8, 3, and 8 months, happily married to a United States Marine Corps and Army veteran. I live in Black Earth, Wisconsin, and I don't have a lot of times for hobbies, but when I do buy and sell and trade and collect vintage Pyrex dishware.
Hi, my name is Jeanette. I'm from Plymouth, Wisconsin. My nursing experience is pretty diverse. I've worked in long-term care, short-term rehab, clinical primary care settings, clinical specialty settings, as well as urgent care settings, which really has led me to Self-Fund Health. Because of all the waste I saw from insurance, financial dollars, physical waste, and I'm very excited to be a part of what we are doing today. When I'm not a nurse, I like to be outdoors. I'm a big camper, hiker, nature, water, sunshine, anything not winter.
Hi, I'm Allie. I'm a nurse navigator at Self-Fund Health, and I live in Milwaukee, Wisconsin, and I live with my dog Reggie. And yeah, I've been in Milwaukee for 10 years. I've worked in critical care as a bedside nurse, and I've worked in both home hospice and inpatient hospice. Passionate about just, allowing patients to have autonomy over their care, and those skills have really translated well into my role as a nurse navigator. And I'm really excited and passionate about what we're doing on our team. I think that some of the clinical background that I've had is translating very well into being able to just guide people and let them know their options and support them as they're navigating our crazy healthcare system. When I'm not working for Self-Fund Health, I'm bopping around the city of Milwaukee, especially in the summertime. There's lots of live music, lots of restaurants. I am a big foodie, and so I really enjoy kind of trying out the new places in the city, spending time with my friends and family, reading, all those kinds of things.
Hi, my name's Sarah. I'm a registered nurse from Lancaster, Wisconsin. I've been with Self-Fund Health as a nurse navigator for almost a year now. Prior to working with Self-Fund Health as a nurse navigator, definitely have a background in healthcare in the rural setting, working in a critical care hospital and long-term care facilities. I find myself outside. In Lancaster, I live there with my husband and 3 boys, and we farm, so anything from dirt bikes to walks to fishing to, we're never dull moment, I guess I would say. So, and just praying that we stay out of the emergency room with all of our fun antics.
Hello, my name is Alyssa. I am from Oshkosh, Wisconsin. I have 2 little boys who keep me very, very busy, and in our free time we love to go to the lake and be outside and be in nature, honestly. My background in nursing, I was mainly cardiology, so I did a lot of pre and post procedural moderate sedation, a lot of acute monitoring, and so really got to see some of the insurance world and how long people had to wait to get approved for these procedures, and the kind of flaws in coverage that really they had to jump through hoops to get these procedures done. So really opened my eyes to how I could work in an area of nursing that could make that better.